All right, welcome everyone to the April WIHA office hours. We're just going to get started with some staff introductions. So my name is Erin Eggert. I'm the Deputy Director here, and I kind of do the behind the scenes operations items. I will pass it over to Amy.
Good morning, everyone. I am Amy Ryan, and I am one of the health promotion program coordinators here at WIHA, and I oversee, let's just say, all of the evidence-based programs except Stepping On and Pasando Forte. So I'm here to help with all your technical support and training, amongst other projects that I have going on too. And I will pass it over to Suzanne.
Morning, everyone. I'm Suzanne Morley. I am the other health promotion program coordinator that does oversee the Stepping On and Pasando Forte programs, and then also the Falls for Wisconsin Coalition and the Wisconsin Coalition for Social Connection. And I'll turn it to Nolly.
Hello everyone, I'm Nolly. I am the Health Promotion Admin Assistant, so I support Amy and Suzanne doing a lot of behind the scenes and data entry. And I'll pass it to Neve.
Good morning, everyone. My name is Nev. I'm a new intern at WIHA, and I recently started this week.
Right. And it looks like Jill is, oh, maybe she's on.
I'm here. Can you see me or hear me?
Great.
Yay.
Yes.
I love Zoom reboots. They're great. Good morning, everybody. My name is Jill Rankin, the Executive Director here at the Wisconsin Institute for Healthy Aging, and it's great to be with you this morning. All right. Do we have everybody do intros?
We have all staff, yes.
Okay, so our agenda for the day, we just wanted to do a reminder of who is here to support you. So we just did a brief intro of our staff. So we are going to do a little icebreaker, and then we are going to talk a little bit about the Community Academic Aging Research Network, CARN. We have some exciting new things happening with the new focus that CARN has had recently that we'll have a guest speaker on and talk a little bit about that. We'll go into some detail about what you can expect with the 2025 Healthy Aging Summit. Yay! We finally have one in person. As those of you remember, we had an in-person summit. I think it was 2018 was the last time we had in-person one. So that's super exciting. We'll talk a little bit about our facilitator trainings and new ones that we added. We'll go over some initiative updates with our coalitions. And then we're going to have a discussion and hear from you guys as to what's happening locally. And we'll do a wrap up. So that's our day today. So for our icebreaker, go ahead and type in the chat. This might be something that you might need to think about for a second, but hopefully it's something that pops to the top of your head. What is something that you love to do, but you haven't done in a while? So I would say like over a year. How long? Something you love to do, but haven't done in over a year. So go ahead and type that into the chat. We'll see how much variety we can get today. Snowshoeing, I agree. We haven't had much snow, so we can't do snowshoeing very often. Fly, go on vacation. Yes, I think Lisa needs to go on a vacation. Traveling, paddle boarding, hanging out on a really warm beach. Scrapbooking, hiking in the mountains. That sounds wonderful. Vacation. Visit the beach, hiking, specifically a beach vacation. I like it. Rock climbing and getting a manicure. I love it. I love that there's a theme too with vacations. So
A lot of beaches.
And beaches, yes.
Kathy's inspiring us all the way,
Yes.
Jill.
Yeah. Good. So maybe there's an idea on here too that you thought of that, hey, I haven't done that either. So hopefully that gives you some inspiration summer is coming up. We've got spring and then summer. So hopefully we can cross some of these off of our list soon. Thanks, everybody. That was fun. All right, I will hand it over to Amy. Let's talk about CARN.
Thanks, Jill. Well, I'm excited to introduce Will Palmer today to all of you. Will is the program manager with the Community Academic Aging Research Network. Otherwise, in our world, we call it CARN to make it a little bit shorter, but I don't always love to talk in abbreviations, especially if you're not familiar with that. So Will is going to give us a quick overview of Karn this morning and talk about some of the exciting things that we have going on with Karn. And Will, I'll let you do any more introduction that you would like. And I think you have the ability to share your screen as well. And you're muted still.
Thank you so much, Amy and Jill. I really appreciate it. So as Amy mentioned, I'm the program manager for Karn, and we work very closely with WIHA. So we're very appreciative that Amy and Jill and Aaron have given us a little bit of time to just share with you a little bit about our UW-Madison program and how it works with communities. And, you know, in earnest here, the Karn program wouldn't be a program without the partnership of WIHA, and certainly not without the partnership of the aging units and the many local service organizations that help our older adults stay healthy and safe. So I'm very appreciative of that. And I'm noticing too, my glasses on are a little bit crooked. My son got a hold of them last night. But yeah, so I'm gonna hopefully stay on track with the time that they gave me. So Aaron, Amy, please let me know if I'm going too slow or too fast. And I welcome any questions. If you need a clarification question, please, put it in the chat or feel free to raise a hand. And if not, we'll have some time for Q&A at the end. So the name of our UW-Madison program is Karn, but the project in which we've been recently funded is called Enhancing Karn to Support Assistive Technology for Research for Safe and Healthy Aging and Health Equity. So really the purpose of why I'm sharing with this today is to inform you of the Aging Network members of the UW-Madison Karn program, and it's working with researchers, community, and healthcare partners in research that is all aimed at improving the lives of Wisconsin older adults through this new idea of assistive technology or products that help us age more safely and more independently. So I'll definitely describe a little bit about that. And then one thing I realized I didn't highlight here is to highlight the ways in which you all can be involved and the roles of which community partners play as partners in research. And then I'd love to get everyone's questions and or reflections on the goals of the program and the ways that you can be involved. So it's really important to us that there's some time for that. So just a quick brief overview of the Karn partnership. So who from the UW-Madison helps fund Karn and network with Karn within the university. And so we have a leadership and staff from the School of Medicine and Public Health, the School of Nursing, the School of Education, Pharmacy, Engineering, computer science, and then we also receive funding from the Office of the Vice Chancellor for graduate studies. So you can see we're really spread out across the campus, and so that's a big calling card, is that we have health scientists, we have engineers that we like to collaborate with, so that there's a lot of cross thinking across the schools. But equally as important, if not more important, and why we're a unique program is we have 4 very key partnerships with community organizations that help guide us. And so we have one that's based in Dane County, which is the African American Health Network. We have one based in Milwaukee, which is actually a UW Center for Community Engagement and Health Partnerships. And then we, of course, have WIHA, who helps connect us with the aging units across the state. And so we kind of consider that more of our rural partnership. And then we have, you all may be familiar with MetaStar, which is key in helping improve health quality care improvement across the state and even in some of our neighboring states. So between the 4 of them, we feel like we have a really good representation of, community network partners that are really working with the important community service organizations that are the boots on the ground, doing the effort and helping our older adults live healthier lives. So we're so fortunate that they're interested in working with us to share the importance of research and getting involved. So we really rely on them to make our work happen. So I wanted to share with you, and I'll share a little bit of history too about CARN, just a brief history, but just to give you guys an understanding of really what at the heart of CARN is, what's the goals of CARN, why, how do we see our path to helping improve, the health, function, and well-being of older adults and increase their independence for aging and reduce these disparities that we see from, communities that are, either very isolated in terms of being very rural and away from a lot of resources, or even urban when they're just under-resourced in their neighborhoods. We see a path to doing that from an academic standpoint of first increasing, the number of partnerships between communities and the researchers that develop these new, what we're going to call, what I'll go over is these new assistive products. But it doesn't necessarily need to be assistive products. These could be self-management programs that you all help implement in your communities, like Stepping On and Tai Chi and the many other the group-based programming that really older adults gravitate to. And our goal is that by increasing the number of partnerships, we can help increase the number of and the reach of effective programs and technologies that can, be available to these older adults to help them live healthier lives. So that's kind of our model and path in terms of our goals and what we do. And as promised, just a little bit about CARN. We've been around a while now. We've actually, we've been an NIH funded program since 2010, in which that grant that we wrote was in partnership with WIHA, and we've been partners with WIHA ever since. And really, it's grown. As you can see, in 2019, we expanded our partnerships to include those of African American communities and healthcare systems. As you saw Metastar, you saw the African American Health Network and the Center for Community Engagement. So we've expanded our partnerships since 2019, and then we sort of called this most recent grant sort of an enhancement to our academic side. So we mainly worked with School of Medicine, some pharmacy, and some family medicine researchers, and a few School of Nursing, but we've really expanded to now work with more of our engineers that are developing these really interesting and innovative ways to help older adults age in place. And a lot of the idea behind this, and I'll talk more about this on other slides, is that these assistive technologies need to be very accessible and affordable if they're going to really help the older adults across Wisconsin, and not just a select groups that can afford it and have that readily available to them, because they it's limited in their access. So that's really at the heart of what we're going to do. And I guess the one other thing that I really actually want to share is the partnership with WIHA. The longstanding partnership has been so key to what we do. Many of and I'm sure I recognized a few of the faces, or excuse me, the names on the call. So some of you might know this, but CARN and WIHA have worked together to get many, I think it's up to 6 of the evidence-based programs that they offer have been developed and tested with UW researchers to get them, scaled up. And WIHA is obviously the key to that. They help translate the research into a full-fledged program. And so that was a huge bit of our work for self-management for chronic conditions and other very challenging impairments and conditions that folks have, to help them remain healthy or help them in their recovery arc after getting a diagnosis or having an impairment. So from 2010 to 2023, self-management programs were such a huge focus of our program. So we've most recently had to switch a little bit, and that's a little bit due to NIH's requirements to become more and more innovative as we seek more funding from them. So I'm going to keep us going here. So I think at this point, it's really important that I explain what we kind of mean by assistive technology. It's a really broad term. So technology, and for our purposes here, as we can say, is any product or device whose purpose is to help people maintain or improve their function or independence. So again, very broad. So this can help them function mentally, hear, see, sensory stuff, move, mobility, care for themselves, take part in more daily activities, in nature, other activities. So I put a few here, some really basic examples, because we might not think of them as technologies or products, but they really are. They're the first assistive technology. And so, when we think of our glasses, our hearing aids, our canes, our telephones, those are all examples of assistive technology that we probably take for granted because they're so commonplace. But we can all remember once upon a time that none of those things were available. Maybe we all knew glasses have been available, but some of the other stuff is, a little more recent. So, but if we go a little bit further, I provided here some examples of more high tech, or I guess I shouldn't say high tech, but a little bit more modern examples of technology when we think of what we use in hospitals, what we use in clinics, what we use for at-home care in terms of, monitors and taking temperatures. And so these can be wearable or implanted devices. Certainly when we think of mobility supports, not just canes, but walkers and wheelchairs, reach grabber tools, even handrails on stairs. And then we get into some of the more, I don't want to say scary, but the little bit more uncomfortable ideas of when we think of, stuff that actually has artificial intelligence with them. And that means, they sort of do thinking. And so these are a little bit more developed examples, but when we think of things at home like Alexas and Siri on your phone, and then we think of even automated vehicles or things like self-driving cars, and a lot of testing on these sorts of robotics and self-automated stuff can be very scary and uncomfortable. So there's a lot of work that needs done on them in order to make them really usable and safe. So that's, again, part of the goal here is for us to actually begin really including older adults and the community organizations early on, so that the developers of these sorts of assistive technology products really understand the user, or the beneficiary, which is the older adult. So we rely on the voices of the older adults and you all to help have the researchers understand the important key ingredients to making it a usable, affordable, comfortable product. So, and really, this may be obvious, but might not be obvious of why this is important. They have a lot of potential. It can help you get, you can feel excluded or isolated from your family who may be using things that are very, technology based. When you think of Zoom and iPads and all these other, apps and things that folks use. So, but they can also, of course, they can potentially prevent impairments, secondary health conditions, improve your functional independence, and reduce your need for support services or reduce caregiver burden. And again, that main piece, really allowing folks to age in place. So we consider this an urgent need to get communities involved so that we're doing a better job of developing these things, so they can be more widely available and more widely usable. And so we in particular, we want to make sure to include underrepresented groups, which often include, very like rural, far-reaching communities when we think of, you know, northern Wisconsin, and when we think of even, you know, really under-resourced areas in Milwaukee. So we want to see if we can do a better job of including them in the research process. And then, so I wanted to give you guys just a little bit of a, I know I'm doing a lot of talking at you, but it's really, I feel like it's really important to highlight some of these key things. So we have an executive committee, which includes folks like Jill and other key organizational representatives from our network partners that help guide us in what we should be looking for in research project opportunities that have, you know, researchers come to us and say, hey, I have this great new study. We really have some important criteria right off the bat that we need to make sure we're considering if we're really going to take on this opportunity. And so our charter from our executive committee has really said, you know, it should maximize the use of it should really involve people with you know, who are often, you know, excluded when we talk about whether it's because they're due to race, ethnicity, geographic location, socioeconomic status, or income status, a fancy way of saying that, or your health, cognitive issues. So there's a lot of reasons why folks may not be included. And then when we're working with them, really help the researchers think about and know that they're going to be considering, you know, what's the affordability of this, the feasibility when we say how, you know, the ease of something, is it going to be something practical, and then the acceptability of it. And that means it's going to be designed in a way that older adults, you know, would want to use it, and it's really not making things more challenging for them. And then again, we really should consider educational components. I think that's left out. Oh, am I doing okay on time? Otherwise I can speed up a little bit.
You're good, Will.
All right. When we think about anything that we're trying to bring new into a community or make available, we should consider an educational component to that, right? So giving supports to how do we educate someone new to using this, and making sure that's done in a thoughtful way. So that's a huge component that we always try to help start thinking about early on, even if we can't, you know, address that from the start. It's something it's going to be addressed eventually in the research. And then consider mitigating. This is a big one, I know, especially for older adults, mitigating the risks. And that includes loss of privacy, reduced access to healthcare services, and for internet-based assistive technology to fail or be disrupted. So if we're really encouraging folks to use more assistive technology, if it's going to really, if it has the potential to fail, we're not actually, if it does fail, we're not all of a sudden they become so reliant and dependent on it that all of a sudden now they're in, you know, in a really precarious spot where now they're, you know, could be unsafe. So it's really important, that last one, that we're not actually setting ourselves up for, you know, increased issues and challenges to older adults. So, and to give you guys a little bit more sense of WIHA's role, I wanted to share with how WIHA and its advisory board of stakeholders helps guides KARN and aids KARN in its sort of, I guess we call it intake process of learning about a research opportunity and project, and starting to become and facilitate partnerships with you all, the aging units that could help really take the research and put it into implementation, into bringing it to the community, and that involves recruitment and other things. So WIHA and its board helps, for one, like Amy does in her role, and I'm going to explain Amy's role here in just 1 second, is to help represent the community at that initial stage. I know it's not, one person WIHA isn't the voice for the whole community, but given how closely they work with you all, it's very important that we have someone there that has a sense of what community priorities are, and what's going to be important and questions that we need to ask. So they also give valuable feedback to the researchers. They help approve projects that are needed with the community. Again, making sure it's in that important need from what they're hearing from you. And then they help identify the community collaborators like you all who have mentioned in meetings like this or parts of aging plans to GWAR or other things like these. This is an important plan for us. This is a goal of ours. This is something we want to do more of or see more of. And then also there's opportunities to serve on what's called a project tailored advisory board, which really means you would help think through some of the important aspects of bringing a research project to a community to help, participate. And so they help guide the researcher in thinking through. So usually that's a board of 8 to 10 members. And some of you may have sit on one before for one of our projects. So, I realized too, and it probably would have been good at more at the beginning is for those of you that don't know a little bit about Amy's role, and maybe I'll give her a moment here to speak about it. But we have, in addition to her program program manager role, health promotion program manager role at WIHA, we sort of ask Amy to do this dual role of what's called a community research associate. And she is really that liaison that helps, take a pulse and provide that initial feedback that I was just mentioning here on the last slide to the researchers to better understand if this is something they want to take to the stakeholder board of WIHA, to understand if this is a priority and to get some initial feedback. So Amy is super key in that initial intake phase of understanding the project and help translating some of the language and getting the researchers level set with how they, meet and talk with community to make sure they're going to be respectful and thoughtful of community partners. But then she also helps guide and bring the collaborators in and helps make sure that the relationship is respective and everybody's, being a valued member. So Amy is the true backbone to our work with WIHA. So we thank Amy for that. And I don't know if there's anything you want to say, Amy, before I kind of cover the ways they can get involved.
That's okay, Will. I appreciate your kind words, and I'll talk when you get done with your presentation for a moment. I'll let you have a drink, though.
Sounds good. Thank you. So the ways in which you can get involved, both as a community partner organization or as an older adult, is really, I've kind of highlighted two key ways here that we typically involve them. And I really want to emphasize the importance that this whole process is something we want to do early. So before the funding and grant is even usually in place, if we can. Sometimes we'll seek partnerships after a grant's already funded, but we'd like them to come early on when they're seeking their funding. So you can see here the early inclusion and continuous input from older adults and community partners throughout the research process. So for assistive technology researchers, we call them what we call our users of the technology, of the product. So they're our end user. And also we can call them our beneficiaries, right? Because we want them to stand to benefit from the technology. So those user beneficiary older adults can be engaged through focus groups and interviews with the researchers to provide their input directly into what's being designed. So, when we talk about a device, being able to hold it, see it, look at it, maybe try it on. We're really careful at this phase not to test it because you need extra approvals, which you can see is bullet 2, but really just to give them understand how it works, interfaces, if it's an app or if it's something you wear, and really get a sense of it, the weight, all of the little aspects that you would think of if I'm going to wear this or if I'm going to use this, what are the things that jump out at me? So we really are looking for that feedback. And then the researchers can make changes based on your feedback and then bring it back to you again and see what you think of the changes made. So we call that iterative feedback cycles for the new developing technology. And then at some point in that process that we'll have you, whether it's the same older adults or it could be new older adults, test this to see how it's working. So usually you test for accuracy to make sure it's working as accurately as you'd expect it to. And then it would move to maybe testing it in bigger numbers and possibly with the folks who have specific impairments or conditions that would stand to really benefit from the device or whatever the product is the goal of the product is. And then really importantly for you all, I've mentioned this kind of, so I'll be interested to hear your all's questions in ways I can be more specific about this, but really you are the partners in the research. You help with the recruitment, we call it disseminate some of the opportunity to be, so, participation in focus groups, participation in testing. So the researchers would really rely on your strategies and the way you reach your clients and your residents with these with these opportunities. And then again, sitting on a project advisory board as someone who's a professional that works with these older adults, interfaces with them on a daily basis, that would be really valuable, whether it's from an administrative standpoint or truly a personal standpoint. We would look for you all to help guide some of what we're doing so that we're doing it thoughtfully, meaningfully, and doing it that makes sense for your community, because communities all are a little bit different. So this is my last content slide, and then I'm going to stop. I just thought it was really important because I mentioned this user-centered design approach. I guess I didn't use the word approach, but what do we mean by user-centered design? It's really the philosophy that we've adopted for this assistive technology project research that we're doing. And I really want to emphasize these first two little tiles you see called empathize and define. What we are trying to, what are really our goal within goals for CARN is to shift the culture and climate for researchers to understand the importance of learning about the older adult themselves, their daily challenges, who is that user, what matters to that person, and explain why is that important to what you're building. That's a huge, huge, huge first step that is often overlooked, and why why you wouldn't consider the person you're intending to use it at the earliest stages is a little bit illogical in my opinion, but it's just something that hasn't been done and so, or isn't done very often. So we really have woven that into our model, as well as this importance of defining and understanding what the needs are or what the problem is, and really making sure that both of those are well understood before you begin to really develop a solution and brainstorm how should we address this problem, and how can it best serve this type of, this person. So these two tiles, we really rely on community engagement and meeting and hearing from voices from the community, and then at the initial starts of those projects. So I think that through this, we can help get to a point when they're being tested and obviously when they're refined here with the feedback, that they can actually be, when they're tested, they don't need a lot of changes because they've been so well vetted by older adults and community partners and clinics about, the best ways to make this. So I'm going to stop there because I've been talking a long time and this hasn't been too interactive. So at this point, I'd love to hear your questions. They could be clarifying questions, or even if I've helped or are helping on a project, I'd love to hear your thoughts on how it's gone, or share your reflections on what it's been like working with CARN. So I'll just kind of open it up. I don't have anything specifically queued up, but welcome any questions or thoughts.
Hi, Will.
And
It's
you can-
Lisa Messer from Rock County. We had partnered with you for the new Lighten Up. I forgot what they call it. We were calling it last I spoke with you. But is there any possibility of that being revisited, or that ship's already sailed?
Yeah, hi Lisa, it's great to see you again. Yeah, I think I guess the short answer is that ship sailed a little bit. I think between the researchers there was some differences in how they wanted to go about some of the approach to what the feedback they were getting from the National Institutes of Health. So we've kind of since sort of broken ourselves away from that a little bit because we had some disagreements, but we wish most of that doesn't happen very often. Especially because we worked on Lighten Up with them for so long. But yeah, that's one of the few cases where the partnership didn't quite finish the way we'd hoped. Sorry about that.
Oh, that's okay.
Hi, well, this is Angie from Guar. I really liked how you were talking about getting the feedback from the folks that are going to be affected by the outcome of the project. Can you talk a little bit about the event that's happening later this month, where you're getting feedback from folks on the AI, or maybe Amy's shaking her head, maybe Amy's going to talk about that and I spoiled it.
No, you didn't spoil it all. I'll let Will take the lead on this one too. It's very exciting what's happening in a couple weeks.
Yes, I will. I'm gonna be very short, and then I want Amy to because I hate hearing myself talk for too long, and I've already done that. So, yes, thank you, Angie, for your great question. Angie also sits on our executive committee. We have what's called our what's we're calling our Assistive Technology Community Academic Summit. It actually has a fun name, but it's actually an acronym and it's long. But it's what we're calling our own CARN Summit, much smaller than WIHA's. Much different in nature, but really what we've done is we had this great idea of having an event where we can bring community healthcare and researchers together to really do what this blueprint does of really starting to learn about the older adult and what the needs are of that community and that older adult, and really start to begin brainstorming all together. Well, Amy and our other CRAs from our other community network partners has said, you know what, let's do this in 2 sessions, because if we really want to follow this little blueprint here, let's focus on just hearing from older adults and just making that a part 1. So we have a session where we're inviting folks from older adults from around the state to come and meet with the researchers, but really have the researchers just be there to listen and have these focus group roundtable discussions to just hear from the older adults and nothing else, to really ask them questions that can really help researchers hear directly from them. What are the daily challenges? What are the daily insights to their life in which maybe a new product or a service that uses technology can help enhance and make it something that's a solution for maybe some of those challenges. So we're really excited to have this session 1 at the end of the month, which we have about 25 older adults coming for researchers to learn. And Amy, I don't know if you want to talk anything about.
Yeah. So, Will, I just really appreciate you spending some time talking a little bit more about CARN with us. It has been just a lot of fun being on this side of CARN, because I have been on the community partner side developing some of these projects in the past from the community side of things. So I think that is really a great thing. I'm going to put my email address in the chat. So if you have any questions about CARN, if you're interested in becoming part of our stakeholder group to maybe hear about some of these projects before they get into more of a formal process to see if it's something communities would be interested in, I'd love to get your name on my list. If you think your community would be interested in doing some of these assisted technology projects, also would be very interested in having a conversation with you. So Will, if you don't mind, if you can put your email address in the chat, if someone has direct questions to you, that would be great. And I think we have to move on, but
Yeah,
Will,
no
we
problem.
do appreciate you joining us this morning.
Yeah, and thank you. I know I ran over time, so I appreciate the grace and in sharing some more. I thought I had it down, but I realize you realize when you put together there's so many little things you could say. So thank you for having me on. And as Amy said, don't hesitate to reach out to us, and we'd be happy to just share more about it before, and you don't have to have any commitments, just to hear more about the opportunities. And um, yeah, thank you all so much, and you have a great rest of your week.
And I will put a little plug in. Will be at the Healthy Aging Summit in
Oh yeah.
person. So all of us who will be there in Stevens Point in a month or so, he will be there to answer more questions as well. And now I'll turn it over to Erin, and she's going to talk about the Healthy Aging Summit.
Yeah, speaking of the Healthy Aging Summit, don't forget about this. We are just over a month away. Registration does close on April 30th. So if you have not yet registered, be sure that you do that. A reminder that those program providers, so if you have one or more facilitators trained in any of the WIHA programs, you are eligible to use our program provider discount. So that code has been emailed in some of our newsletters, but it's also shown on the screen here. That will get you $10 off of your registration. We're really excited about the Healthy Aging Summit this year. As Jill mentioned, I think at the beginning, this will be our first in-person summit since 2018. So it used to be biannually, and then the world changed. And so we are getting back to those in-person conferences, and we're really excited to see everyone, and we hope that you can all join us. We do have our agenda finalized. You can find that on our website. It's shown on the screen as well. And we are making some edits to that currently. So we're also going to be adding to the agenda a piece on the legislative update. So what is happening federally, and then also in Wisconsin, the budget process and ways you can make a difference. So we'll be adding a little section that's not yet represented on our agenda, but we will be adding that coming soon. Just also a reminder that you can use 3D funds for this. I'm going to have Angie Sullivan just touch base on that piece because I think it's set to a specific amount.
Yep, exactly. Yeah, thanks, Erin. So program providers that are aging units using their Title 3D dollars, this will be of interest to you. You can use up to 25% of your Title 3D, ARPA-D funding to attend the Healthy Aging Summit. Just keeping in mind that when you do spend 3D funds, there typically needs to be a service, or there does need to be a service when you enter the data into PeerPlace. That's why it's up to 25%, because we should see an implementation of an evidence-based program in your community. So if you have any questions on that, I will put my email in the chat as well. And there is a question and answer on that on our 3D frequently asked questions document.
Great, thank you. And then one other announcement for the Healthy Aging Summit. So we did decide just recently to open this up to non-professionals as well. So we sent out an invite to all of our past participants this week with a discount code. So non-professionals, just those older adults in general, can attend the Healthy Aging Summit as well. And that it would be a 50% discount. So that discount has been sent out, or codes of that, to all past participants. If you have participants within your local communities that might be interested, please feel free to share that. And we'd be happy to have those older adults join us at the Healthy Aging Summit as well. There should be a lot of interest there with our 2 keynote speakers, and then some of the other things that we have going on as well. All right, I'm going to turn it over to Amy to talk about our upcoming facilitator trainings.
So thanks, Erin. So we do have yet some spring and summer facilitator trainings coming up. We did, just with demand, changed our Mind Over Matter May facilitator training and our Stepping on June facilitator training are now both online instead of in person. So hopefully that makes it a little easier to attend those facilitator trainings. Also, because of demand, we added a brand new Healthy Living with Diabetes that will be online. I know it's in the summertime. It's a couple days a week in the morning, so that you can get your training in the morning and then go out and be in the sun and on the lake in the afternoons, maybe is a possibility. So some of those training deadlines are coming up fairly quickly. So if you are interested in those trainings, feel free to check out our website under facilitator trainings. There's a lot of more information on that, or feel free to reach out to any of us on the WIHA staff. We'll be happy to answer those questions. And I think that's all I'm going to say about facilitator training. I'm going to turn it over to, I believe Suzanne is going to talk about some programs and initiatives that are happening.
Awesome. Thanks, Amy. Just wanted to share a few quick updates about first Falls for Wisconsin. So if you missed it or if you haven't seen it yet, we did at the end of February release a new toolkit. I'm not going to name the whole title here, but essentially it is for community-based organizations and EMS providers to look at and then work together and then collaborate in local communities to prevent falls. So the toolkit lists, I believe, 6 or so different strategies that EMS providers and community-based organizations like Aging and Disability Resource Centers can do to prevent falls related to referral systems, falls prevention coalitions, integration with healthcare, and a few others there. So we did just do a webinar on the toolkit as well that had some of the partners that helped develop the toolkit present on what they're doing. So that is all on the website with that link. And then within the last month or so, we released our spring media campaign for Falls for Wisconsin. So we've been doing quarterly media campaigns, and this topic for spring, we're doing it related to pets and balance. So we have some cute social media posts with some pets on there. So take a look at those. We'll be sharing those on our Facebook page in May, but feel free to share those starting now or do that in May, whenever you kind of feel free, have that fit in your schedule to do that. And then there's also a press release and a newsletter article there too. And we'll also be scheduling a consumer webinar sometime in May. So more information on that will be released soon. And if you're interested, we have at noon today our quarterly collaborative meeting. So I've dropped the link there. If you haven't registered for that, feel free to join us. We'll be talking about communication strategies to prevent falls today at noon. And then related to the Wisconsin Coalition for Social Connection, we have a few things coming up too. So on May 20th, we are doing a consumer webinar. So partnering with WIHA's Age Well series, but hosting a webinar for older adults on the topic of navigating mental health in older adulthood. So we'll have a speaker talking about 988 Wisconsin resources, someone talking from Extension about one of the programs that they have for older adult mental health, and then also a geriatric psychiatrist on there. And then for professionals for the Wisconsin Coalition for Social Connection, we have an upcoming network meeting next week, Tuesday. So if you're interested in learning more, the topic for discussion on April 15th will also be older adult mental health, and we'll have the same geriatric psychiatrist on there. And then also someone from Mental Health Wisconsin, Prevent Suicide Wisconsin, talking about suicide for older adults and people with disabilities. So take a look at those links. I'll drop some of that in the chat too. And I'm just going to look at the question here quick from Lisa. Does the falls prevention toolkit go to local EMS directly, or are we be the liaison and make sure they know about it? I have sent it to EMS providers throughout the state. It's also been sent to the Wisconsin EMS Association, but it doesn't hurt to send that out to your local providers too, since you do have that relationship most likely. Good question.
And there's another question from Terry about if these slides will be available. And Erin, the answer is?
Yep.
Yes. I think they will be going out in our WIHA updates early next week. So you'll be having those. All right. Well, we've been doing a lot of talking, or Will did a lot of talking so far today. So what we'd like to do is just open it up to the group, so you can feel free to come off mute or put it in the chat. But we'd like to just hear a little bit from each of you in the last couple of minutes we have today on what's really going well in your community in regards to your evidence-based programming that you're implementing. So if you can share with us, we would love to hear some of that feedback.
I'll just share first. Mind Over Matter is so popular. like I don't really have to market it very much. People just start calling and getting on the waiting list for the next class. So our Aging and Disability Resource Center puts the information um, in their newsletter, and I just get people calling all the time. So thank you. I just am a big fan of WIHA and that curriculum in particular. That's the one that I teach right now, but I just love what you all are doing. And this call has been super informative. I'm sort of a newbie in this area, but I just appreciate all the information that's coming, and all the research that you all are doing. I just think it's fantastic. Thank you.
Thank you, Terry. Well, I'm glad that you're having some success with the ADRC newsletter and really promoting the Mind Over Matter program. That's great to hear. Anyone else want to share some things that are going on that are working well in implementing your workshops?
In Rock County, I've got a new leader. One retired last fall, so I'll be assisting them in a Janesville Stepping On workshop. We're also partnering with Greene County to try to do one kind of between our two counties. But everyone in my county wants to go to Janesville instead of Broadhead. Then hopefully we have one in fall, pending the continued funding of one particular leader. But we've also been approached about doing a Stepping On workshop for a low vision group that meets at one of the senior centers in our county. So if anyone has done anything, I was wondering if any of the Stepping On materials are available in Braille. I think, was it Barron County that has done something with the low vision group or people who are blind. So I need to connect with them. I think it'd be a neat opportunity, but I guess I have some questions on how big of a size a group we would maybe need to limit it to, or have a minimum. If weight 8 would be okay. So anyway, that's floating around out there, but it's something I think would be a really neat opportunity.
Yeah, thanks for sharing, Lisa. I know Barron County has done that, so I definitely recommend reaching out to them. And we do have a toolkit on our website under the Stepping On resources for people with, vision or hearing impairments. I often get the request if we have large print handouts, and at this time we don't. I know there was with the old curriculum, but it is something that we're working on. So hoping to have that available.
Thanks, Lisa. Thanks, Suzanne. Well, because of time, I just want to move to the next question on our list. What other health promotion initiatives or projects are you working on that maybe we at WIHA don't know about, or maybe our folks on this call don't know about? Anybody doing anything different or have some other projects that they'd like to highlight?
I have something I would like to share.
Great, Jennifer, go for it.
So in Milwaukee County, we are working with the American Heart Association, and we recently implemented blood pressure hubs at our 5 county-owned senior centers. So we got tabletop kiosks for people to check their blood pressure when they're at the senior centers. And then we also got, for each site, we got portable blood pressure cuffs that people can rent and take home for 2 weeks at a time. And then, so all 5 of the senior centers are doing that. And then in addition to that, we are partnering with some of our federally qualified health centers and other community professionals. And we're doing an educational series where once a month, each site has a different topic as it relates to heart health, a different presentation, I guess you could say. And so we've got diabetes presentations, food and nutrition, physical activity, and then mental health. And it's all the presentations are based on they make the connection back to heart health and how important it is to manage those things as in addition to managing heart health. So we've got those going on every month at our senior centers, and then also working with the FQHCs to refer people to the senior centers to check their blood pressures if they don't have a unit at home. And then vice versa, you know, we'll refer people out to healthcare providers if they check their blood pressure and it's high. So
Well, that's a great program. And I love to hear all the collaboration that's going on, not only with the American Heart Association, but your senior centers, the health networks. So that is great, Jennifer. Thank you for sharing.
yeah.
So I'm going to read a couple things in Waukesha County. It looks like they're celebrating their 1-year anniversary of their Fall Prevention Coalition. Yay! High five to all of you. And Racine County has a occupational therapist who is retired and offering Tai Chi for fall prevention. That's exciting too, to be working with maybe some of the recent retirees to offer some different programming as well. Well, thank you all for sharing. It has been great to see everybody, your faces and your names today. And I think I'm going to pass it over to Erin, and she will wrap things up in the last couple of minutes that we have.
Great. Well, just notification about our upcoming communications. So WIHA update will come out next week, I believe on Monday. So that will have the recording from today, as well as some written things about some of the things we talked about. Our Age Well newsletter, a reminder that that's the one that's kind of geared more towards what we call our consumers, or those older adults. That will be coming out on May 5th. Our Healthy Aging Summit is May 15th. We hope to see you all there. And then just notification on upcoming office hours. So our next office hours will be July 10th. And then we also have one in October. So we hope to see everyone there as well. I'll leave these last couple moments available. If anyone has any questions, we will be on to answer. Otherwise, thanks everyone for joining us today, and we hope to see you at the summit.
Thank you, everyone. Have a great day.